welcome to Elements of Ayurveda, Empowering Wisdom of Life. I'm your host, Colette, and in this podcast, I hope to empower you to take charge of your own health by sharing the holistic teachings of Ayurveda, the ancient healing tradition from India. We will also discuss topics like health and wellness, nutrition, yoga, fitness, meditation, breath work, and much more, as well as interviewing lots of inspiring people along the way. My humble wish is to help you to connect to your true nature, to Mother Nature, and to each other. If you like the content, be sure to subscribe to the show, and the new episodes will automatically download for you to enjoy. If you're new to Ayurveda, I recommend you listen to the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. I've also set up a Facebook group for us to connect and to support each other, and I'd love for you to join me over at Elements of Ayurveda podcast group. And now here's the show. Hello and welcome to Elements of Ayurveda. Today as my guest, I have Dr. Eric Grasser, who is one of the world's foremost experts on the integration of Ayurveda and functional medicine. He founded his integrative medicine and Ayurveda practice in Santa Fe, New Mexico. He attended Stanford University, Dartmouth Medical School, University of New Mexico Family Practice Residency, and the Ayurveda Institute, and is a clinical assistant professor at the University of New Mexico. He is board certified in family medicine, trained in functional medicine through the Institute for Functional Medicine, and certified by the Academy of Functional Medicine and Genomics. He hosted the Ayurveda Summit in 2015, the largest ever online Ayurveda event. He serves on the board of directors of the National Ayurvedic Medical Association, NAMA, and he offers online programs and consultations throughout the world. Dr. Grasser, it's an honor and a pleasure to have you on the show. Thank you for joining us today.
Thanks for having me, Colette.
My pleasure. And my goodness, what a wealth of education you have under your belt, Dr. Grasser. Can you tell us a little bit about your educational journey? Did you start with Western medicine and then move towards the ancient traditions?
Yes, I did. I went ahead and took what was a traditional path from medical school to residency, moving to the desert Southwest here in America because I wanted to speak Spanish and be in the mountains.
Great.
So it was the perfect place for that. And I became entrapped. We call New Mexico the land of enchantment, but we also call it the land of entrapment. And this is where I ended up, and I ended up staying. And I always knew that I kind of had a different attitude towards life, I guess, in general, and also towards health and healing. But I really wanted to solidify a skill set in traditional Western medicine and go ahead and jump through the hoops, so to speak, to get proper training in a broad spectrum of areas of medicine, which is why I chose family medicine. So I went ahead and did that. I finished my residency and then worked in a variety of settings in this state, from acute care, emergency, to hospital medicine, outpatient clinics, lots of obstetrics and delivering babies and whatnot. And then I discovered yoga and became fairly interested in the practice of yoga as a both, the physical elements, but also the philosophical and lifestyle elements. And then as a result of sort of getting into the yoga community, I was turned on to Ayurveda and serendipitously discovered that Dr. Vasant Lad and his Ayurvedic Institute were right here in my home state. So it seemed too good to be true that I had discovered this ancient wisdom system and that I had the opportunity so close to my home to study. So I quit my job in 2008 and enrolled in the Ayurvedic Institute for 2 years between Albuquerque and India. And then there was really no turning back at that point. I had to integrate the systems and I had to practice a holistic version of medicine. And So I decided to open up my own practice here in Santa Fe in 2011. And in the meantime, I think just by declaring in my mind and outwardly that I was dedicated to holistic medicine and integrated medicine, that led me to functional medicine, which I really see as a modern holistic medicine. And I took my first course in functional medicine and just kept hearing the wisdom of Ayurveda restated in much more modern terms. And so immediately I think I knew that my academic interest, if you will, would be the commentary of the integration of both Ayurveda and functional medicine.
Beautiful. And do you see functional medicine then as a bridge between the ancient wisdom of Ayurveda and then modern Western medicine?
Yeah, I do. I mean, I see it as, it's a lot of people want, they live in a modern world and they're used to, an empiric version of knowledge where, you have a theory and then it gets tested through scientific methodology and then proven with results. Mm-hmm. And that's what functional medicine does. It's built on the language of modern medicine and laboratory science and nutrition and systems-based biology. And that's very appealing to people if they want to actually be able to see how A turns into B and B turns into C, and they want numbers and they want scientific studies. But really, Ayurveda is so much more broad and so much more, I think, powerful because it's a consciousness-based system, whereas functional medicine is still a reductionist-based system. Although they certainly engage and speak about, meditation and spirituality and mindfulness, which are beyond just a linear reductionist-based system. But the bulk of functional medicine, as it's taught, is still built on a linear platform.
Okay, and before we go forward, obviously my listeners are very familiar with Ayurveda, but can you give us a description? You gave us part description there of functional medicine, but how would you describe it before we go forward?
Yeah, I mean, that's something that we get asked all the time, and I think that I still kind of make up the answer each time because really functional medicine is a movement. I call it a movement more than an actual discipline because it's so broad. It has the potential to be so broad, but a little bit of background. I mean, functional medicine was a term that was adopted by some very bright thought leaders some 30 years ago, PhDs, MDs, chiropractors, osteopaths. They got together and sort of said, I think we're kind of on the same page as to what we're believing in and trying to do here. Let's call it functional medicine. One, because it really looks at functions in the body more than reducing the body into a set of organs that may or may not have a very easy to appreciate linear relationship. And two, who wants dysfunctional medicine? Yes. That's the joke, yes. Yes. So, but I would say some terms we use, which I already mentioned, systems-based biology. So when you think about it in Western medicine, if I, as the family doctor, or what many parts of the world call the GP, if I have an issue with a patient's heart, and I need a specialist, I'll send them to a cardiologist. If I have an issue with their lungs, I'll send them to a pulmonologist. So that's what Western medicine has done. It's broken the very complex but beautiful human system into a set of organs and specialties that are in charge of dealing with those organs. But then whose job is it to look at inflammation in the body? Whose job is it to look at, for example, oxidative stress, or the interconnected languages that the body speaks. Who puts together the language of the nervous system, which is neurotransmitters, and the language of the immune system, which is cytokines and interleukins, and figures out that all these systems are polylingual and they all understand each other. There's no specialty for that. And so functional medicine, I think, evolved out of the realization that these are real networks and webs that are occurring in the body, and that nobody really is an expert in looking at that. So why don't we try to become the experts?
Right.
And
very good.
It's also called upstream medicine, root cause resolution medicine. They're different sort of terms, but I think different functional medicine practitioners would give you different answers when asked to describe what is functional medicine.
Great. Thank you for that. That really helped. And you talked a moment ago about how you feel functional medicine is still a little bit reductionist. Do you use then Ayurveda to flesh that out a little bit so it's more of a holistic approach in your practice?
Yeah. Mm-hmm. Yeah, I do, because obviously, I work with a lot of patients who didn't get the answers they were looking for from a traditional Western approach. In other words, a toolbox. So you walk into the doctor's office and you've had 20 years of fatigue and joint pain and gut problems, and they walk in with a toolbox of a certain set of laboratory diagnoses or laboratory analyses and a certain set of imaging studies and, a brief physical exam. And they're looking to fit your set of symptoms and results into a structure that's, fairly well defined, a criteria or whatnot. And that's not how that's not how life is. That's not how nature is. That's not how your individual body, mind, and soul interact with the rest of the world. And even functional medicine, which goes a lot deeper and tries to look at, like I said, interconnected systems, it doesn't necessarily, it's not really built on a platform that is open to exploring things like your daily routine, your spirituality, your how different events in your life have affected the multiple layers of your being. Right. So it's just, we're still operating in functional medicine on that biologic molecular plane. There's just so much more, which Ayurveda has done such a brilliant job of describing and organizing, if you will, into its own system.
Yeah, absolutely. And it is such a big jump, isn't it, from modern medicine to Ayurveda, that functional medicine is that bridge now, but we need more. And I love on your website, when I was looking at it before our chat, you said that healing is achieved in a holistic, compassionate manner, considering the body, mind, and soul of the individual, as well as the health of the community and the environment, respecting the laws of nature and nurturing the innate harmony and healing force of the environment, the community, and the individual are paramount. And that's what you were alluding to definitely a moment ago. Can you speak a little bit more about the importance of taking into consideration everything in a person's life?
Well, of course, we don't live in a vacuum. We don't live in a linear plane. And I think that for anybody who is working with clients or patients through any number of healing systems, be it Ayurveda, Western medicine, Chinese medicine, energy medicine, Reiki, you name it, they realize that there's not always a consistent parallel between what is being discovered through signs, symptoms, and diagnostic testing and how the patient actually feels. And this was something that became very frustrating for me when I was restricted to only the Western medical system. People would come and say, I just don't feel well, but the doctors tell me there's nothing wrong with me, or it's all in my head.
Yeah.
And the reality is nothing is all in anyone's head, which fortunately we now have modern science as if we needed it. We have plenty of modern science to prove that it's not all in your head. I mean, most of the serotonin is made in the gut. Most of your immune system lives in your gut. Your brain and your gut communicate directly through the vagus nerve. I mean, we have plenty of proof that things are not just limited to somebody's psychological field. And I think that that frustration that I used to have, I no longer have, because now I have so many other tools available that I can, confidently say to the patient, there's always something that we can do to help you feel better.
Right.
And I say we, but it's most of the work needs to be done by the patient.
Yes.
I like to say it's 80, maybe 70% patient effort, 20% physician, and 10% divine intervention, or God, or whatever you want to call it.
Yeah.
But the patient has to do a lot of work, but I can be a guide to uncovering things that they wouldn't have basically been able to have access to, or putting things together in a way that they wouldn't have seen before. And so, that's the beauty of Ayurveda, is that it's a full knowledge system of life. It's not just medicine.
Yeah, absolutely. And I do think it's very important for the patient, the client, to be active in their healing, because then it's sustainable, right? Then you're educating them rather than just healing something and, them going back to old habits or routines. You're actually educating them and empowering them to take charge of their own health.
Absolutely. And it is work. I mean, there's no free lunch in life. You need to do the work, but the work can be simple and very doable. And a lot of times, I don't think that anybody should be ashamed or feel like they're weak because they do feel powerless. I mean, we get to the place in life sometimes where we feel powerless, or we just can't really understand what's going on with us, and we need a professional, a guru, a wise person, somebody with experience, a loved one, to kind of give us a different perspective, or maybe put some things together for somebody in order to show them the work that they need to do, because we can get completely buried in a paradigm, and then those, that paradigm, or that way of looking at things becomes more fixed, just like, drawing a line in the sand over and over and over again. It becomes a bigger and bigger line, and deeper trench. And then, it takes some momentum shift to get out of it and see that there is another way, and understand the work that needs to be done to get there. But like you said, the person ends up needing to have to be the one to do most of the work. And in Ayurveda, the simplest thing we do to start is just changing the habits. Yeah. Changing the dinacharya, the daily teacher, the daily routine. And it sounds simple, but it's really quite powerful.
It is quite powerful, these small effective changes. And we talk about that a lot on the podcast, which is great. And I think what's a shame nowadays is that Western doctors have so little time with their patients, right? They have, 7 minutes or something to turn over?
Right.
So how do you incorporate this into your practice? Do you have a certain protocol, or is it case specific?
Yeah. Well, I have protocols, but again, ideally I want to treat everyone with a customized approach that fits them and what they're ready for, and what they're kind of interested in.
Right.
Like many of us integrative doctors, and I can speak mostly only for America, we have had to build an alternative practice model in order to have the time that we need with patients, and use resources outside of the one-on-one face-to-face time, such as group classes, protocols that people can go through that we set up in groups, detoxification groups or gut healing groups or whatnot. Mm-hmm. And then a lot of practices will use health coaches as well. So I have what's known as a membership-based medical practice, where people pay me a small monthly fee to have me as their doctor. I'm in a system that's kind of known as, I call it membership-based medicine. I actually call it meaningful medicine. It's a term that I came up with
myself.
I like that. But it's I use insurance, but then there's a monthly fee out of pocket as well. Other practices end up just dropping their relationship with insurance and the Medicare, which is the public health system for people over 65. A lot of doctors, integrative doctors in America, will just sort of finally just get rid of those relationships, and they take the elephant out of the room, I like to say. Because there is some restriction to how you need to, shall I say, if you're using insurance, you have to fit into their box, and you have to basically, unfortunately, turn somebody into a list of codes and diagnoses that usually feed directly into pharmacotherapy and drug treatments.
Right.
And then you're somewhat limited. So I still play those games, but I have much more time with people because of the membership.
That's great. I love that idea. And that the membership then means education in group formats too, because obviously you can see clients one-on-one, but there's certain things that can be done in group format to save you time, so you can see more people. Yeah. And it's true, I used to work in a holistic health center in California, and it was such a shame that people are asking, well, do you take insurance? And, obviously for money reasons, that they're determining their health care by what their insurance covers. So there's that real stranglehold that it has, which is a whole
I think
other topic.
We don't have to go there, but we...
But it's so wonderful to see this, like this personal lifestyle medicine, right? Which is something new that's coming in, and wonderful to see that there is a membership. So you're not just going to see you. The clients are not just going to see you one time, but okay, let's now enter the program and start do your Prada yoga and lots of different other mindfulness techniques as well. Yeah,
absolutely. And it's a commitment.
Yeah.
I mean, it's not a la carte medicine. It's not, I like to say, unfortunately, the way our system is set up, because of the way insurance works and for many people, insurance is really just insurance against, a catastrophic event, or insurance that you're not going to have your financial resources depleted if you end up with a chronic illness, an emergency, or a catastrophic or serious event like cancer or an injury or whatnot. It doesn't really ensure that you're going to get proactive, wellness-based care. That is actually whittled down quite a bit. So I like to make my practice a proactive, wellness-based, in addition to the sort of standard reactive, disease-based practice, where we just wait for people to get sick, and then when they're sick, we say, okay, now you have to come in every 3 months or whatever, or just I'm here for you when you need me if you have a sore throat or whatever. Yeah. That's not what I do. I mean, all of my members, they do get enhanced access to me for when they are unwell and when we are managing their chronic issues. But I also provide content to them on an ongoing basis through online, courses, journal club, I call it, Facebook Live, live membership events a few times a year where we all get together and I do a lecture and then we have a Q&A. And then also just because I live in a small-ish community, we build relationships with local businesses so that people have affiliate discounts and they, kind of, if I have 10% of my patients going to the same gym, then, and I know the owners of the gym, then I know, what kind of exercise they're getting. And I can check in with the trainers and the gym owners to say, how's Mr. and Mrs. So-and-so doing with their strength training.
Wow.
And so then it just becomes like a more integrated, community-based way of delivering healthcare.
That's beautiful. Yeah, and you're looking at every aspect of your life, and like you said, it's health centered rather than ending up in a manifested state of disease. And it's such an education. You're really getting them to live the lifestyle and getting them to commit, which is good with the membership base because that means they're committed. They're investing in their health, which is great.
Absolutely.
Yeah, that's fantastic.
And accessibility is another thing that's just so much better in a membership-based practice because the physician doesn't have to take care of thousands of patients. He or she takes care of hundreds of patients. Therefore, there's more time with each individual patient and more accessibility and availability because one of the things that I think people are craving is they're craving trusted individuals for curating the massive amounts of information that are available now to people.
Yeah.
And we are in the post-information age. We are going back to knowledge, which is beautiful. Mm-hmm. And that's what Ayurveda has been for thousands of years. But people need somebody they trust who also ideally knows them to provide that knowledge, to guide them, to offer perspective, and then therefore they can then go execute the plan like we were talking about before. Because unfortunately, as much as I think we're trying to allow people to diagnose and treat through the internet, and this is only going to become more prevalent as artificial intelligence comes into medicine, there is no substitute for a trusted advisor who has the experience and knowledge and has basically, dedicated themselves to curating all this overwhelming information and help guide you on whether it's, what to eat, how to spend your free time, how to do your movement, your meditation, your mindfulness. And so, it used to be the village doctor, healer, shaman, or the grandmother in the kitchen. It might be a best friend, but it's really not, at least in our country, where they're not really going to their doctor for that kind of knowledge anymore.
Right.
And so that's something we're trying to kind of recreate, is that, that I'm a trusted source of information and knowledge for people. And just the fact that they can get a hold of me and know that I'm there for them if they have either a simple question about a choice they have to make related to their health, or if they end up having a serious medical condition that they need guidance on.
Wow, that's really wonderful. And I agree that it's almost people get decision fatigue right now because there's so much information out there. And when they can have a trusted person, and I think people crave, as we know, the connection and the community, which is what you're providing as well. And that they know they can have that one person that they can go and ask. I think that's huge because...
Absolutely.
And I think as well is, whether your consultations are in person or online, there's so much more that you capture just from looking at that person, either on the screen or in person in front of you, that technology can't. Like we're talking about artificial intelligence coming into the medical system. There's so many nuances, right, that you can pick up from somebody in person.
Absolutely. And it is coming. Just to kind of give an example, what will happen when the AI comes into diagnosis in medicine is, the patient will come into the system and say that they have a chronic condition of fatigue, muscle aches, joint pains, brain fog, and they'll plug in all the tests that they've done before, and there won't be a rheumatologic disease, there won't be a infectious disease, and the computer will spit out that the person has fibromyalgia, which, could have been done without artificial intelligence, just by a physician, but it still doesn't help the patient. So now what? Well, What is fibromyalgia? Well, the artificial intelligence computer or the textbook will say it's a condition with these 5 criteria and this many tender points on the body, but that doesn't help the patient. So what? Or I have irritable bowel syndrome, or I have anxiety. Those are names. And we know that Ayurveda says not every disease is named, and functional medicine says don't name and blame. So, what are we going to do about this quote unquote fibromyalgia, if that's what you want to call it? Or Ayurveda would have a much different, set of terminology to describe what's happening with the person. You've got to go find out, kind of go upstream and find out, what went wrong, where did the imbalance come in, and then how do you turn that ship around and recreate balance, and get that person looking more like the individual that they were meant to be, rather than, of course, treating them like anybody else, which is unfortunately the limitation, again, of what I call the reductionist-based system. Get 100 people with fibromyalgia, whatever that is, and they're all going to basically be told these are the small set of medications and treatments that are available to you. But you're talking about one person is a vata deranged fibromyalgia and the other person's a kapha deranged fibromyalgia. They shouldn't be treated the same way.
Absolutely. Yeah, I think that's so important, meeting the person where they are if they have an imbalance currently, but also meeting them where they are. And this comes with a one-on-one approach in education of their health. Because a person could come in with an imbalance and they have more knowledge than another person. So it's also meeting, I think you alluded to this earlier, it's meeting a person, see what their capacity is. Maybe their capacity is, I want you to go home and go to bed at 10 o'clock at night. And that will be your homework for this first meeting, versus another person, you may be able to give them several dinacharya and give them other mindfulness techniques, etc.
Yeah, absolutely. I mean, it touches maybe on a few things. Like, one, what is the person, if you're just sticking with an Ayurvedic perspective, I mean, and you're the Ayurvedic clinician, what do you think the samprapti, the pathogenesis of the condition is, and what is the proper course of treatment, versus what is the patient ready to do, and what is accessible to them? And they're not always the same thing. And people, like you said, they're at different stages in their healing journey, if you will, and their readiness to accept what your assessment is, and then be ready to undertake the lifestyle modification. Because for most of us that are Ayurveda educated and lovers of Ayurveda, believers of Ayurveda, and maybe practitioners of Ayurveda, I mean, for most of us in the West, we're not classically trained. So we're using more of the lifestyle treatments than, say, the the herbal remedies and rasayanas and panchakarma. Right. So, it's a question of what is that person ready to achieve. The beautiful thing is that Ayurveda has so many different tools available to it, starting out with very simple things, and they can have a profound impact on somebody. The very simplest of treatments.
Absolutely. Yeah. And so what do you think the future is, Dr. Grassler? It's a big question. What do you think the future is with Ayurveda and in medicine in general?
Well, okay. And again, I'm sort of speaking from having only practiced in America. And so if you want me to speak about Western medicine in America, I can't avoid thinking about how the delivery system is going to affect the medicine in general. The politics, the economics of the delivery of medicine is it's inseparable from the actual medicine itself anymore. Mm-hmm. But I think that actually we are still, the pendulum is still swinging in the direction of reductionism, if you will. It's still swinging fairly heavily in the direction of volume-based medicine, where patients are just a number and they're being kind of cranked through the system, despite maybe, the political posturing, which would say, no, we're making it more patient-centered. Mm-hmm. I actually don't see that. I think that there's an obsession right now in America and other parts of the Western world with data collection, where they think that if they just collect a bunch of data, that they're going to be able to make the healthcare delivery better. But that is not patient-centered, unfortunately. It's not personalized.
Yes.
And so that's going to take a while for it to burn itself out before the voices of the patients and the physicians are actually heard, and we collectively pull the pendulum back to swing in the other direction.
Yeah.
And I don't know how long that's going to take.
Right.
And I may not see that in my career, although I would hope to, because I still have, some decades left to practice. And artificial intelligence will penetrate medicine soon, I believe. And it also, although it, will seek to make things more personalized, it still will play into a reductionist-based system. So that's kind of my somewhat maybe a clouded view of the future of Western medicine, at least in this part of the world. With Ayurveda, what you're having is the movement is growing. The interest in Ayurveda is growing. We know that statistically, like you mentioned when you introduced me, I am on the board of directors of the National Ayurvedic Medical Association. So we track these kind of things, like what interest is and enrollment in Ayurveda schools in America, and things are just increasing. And our membership is increasing. And I like to say part of that is that it's riding on the coattails of the popularity of yoga as a sister science, which is fine. What you're going to get is, though, a lot more people who are Ayurveda interested and Ayurveda educated, but in a way that is different than what classical Ayurveda education is in the Indian subcontinent. And so we're going to have to navigate that.
Right. That doesn't become reductionist also, and just focus on the doshas and yeah.
And that people are not, they're not, I think it's a fine line between honoring the ancient wisdom and the tradition, which has survived for so many years, on its strength and its beauty, versus, what ends up becoming a modification and an evolution of an ancient science and knowledge system when it sort of gets its day on the stage in the West, and now of course goes back to its origins, because the popularity of Ayurveda in the West has fueled a resurgence of popularity of Ayurveda in its homeland.
Yes.
So so that's something that we are going to have to navigate, and hopefully with maintaining the beautiful potential of Ayurveda and not bastardizing it in a way that sort of erodes its potential and its power, which arguably you could say has happened to elements of yoga or elements of yoga, that shouldn't really be called yoga or per se, but now that's a household word.
Yeah, it's true. Well, I think yoga expanded before there was any kind of governing body or overseeing body. I think there was nothing there. But when you have organizations like NAMA there to accredit schools and accredit courses, I think that's really important to maintain the traditions of Ayurveda, because unfortunately sometimes in the West we like to cherry pick. I'll just take that and ignore the rest. Yeah. And that doesn't, and especially with Ayurveda, it doesn't work because you have to look at everything,
Absolutely.
So what is a positive thing is that people are now taking health into their own hands. At least I feel, in my optimistic outlook, that people are now understanding that they're educating themselves. They can access information easier. And that you were talking earlier about the pendulum swinging, and that between doctors like yourself having a new approach to health and wellness and to your clients' practice, and clients themselves going, okay, I want alternatives. I think that it may come from the doctors and the patients themselves, this change.
Yeah, absolutely. And I mean, 95% of what people are suffering from is not something that probably needs complex, intensive treatment approach, whether you're talking about Western medical treatments or Ayurveda treatments. 95% of the suffering is correctable through simple practices. And I would say Ayurveda is a perfect antidote to the root causes of most of this suffering.
Yeah.
That is not to discount the 5% of people that have serious medical conditions, or who have their pathogenesis of the disease gone into the manifestation phase. Those people can still be helped with Ayurveda and Western medicine, functional medicine. But most of what we're dealing with as an epidemic of dis-ease and imbalance in our society is fairly easily correctable through basic practices taught to us by Ayurveda and modified as needed for the modern world. And this is disconnect from community, the erosion of close personal relationships, the overwhelm from constant overstimulation from technology, the loss of daily habits. And, this is stuff I'm sure you talk about on your podcast all the
absolutely.
time. Yeah, absolutely. And maybe it's not even sexy or, cutting edge or, technologically super advanced.
Right.
But, so I hate to, spoil the punchline, but you got to just go back to the basics. And most of the time that's actually going to fix a lot of what's going on with somebody.
It's really about going back to the basics, connecting to nature again, looking at the circadian rhythms. Okay, am I living in alignment with nature? And I think that's the best place to start. But yeah, sometimes we just want to throw money at things and have more gadgets.
Yeah, well, we want a quick fix.
Yeah, there you go.
We want to believe that, somebody's kind of figured out a shortcut.
Right.
But there are no shortcuts, unfortunately.
No, that's why, modern science is proving what Ayurveda said 5,000 years ago. It's like, oh, okay, our clock genes and chronobiology, all this is important. And so there's a reason why Ayurveda has stood the test of time, right?
Absolutely.
Yeah.
It's a really beautiful, beautiful thing.
Great. Well, thank you, Dr. Grasser. And I don't want to keep you too long because I know you have a busy day ahead of you. But what I do want to ask you is what advice would you give listeners today? And you touched on a lot already, but could you give them some little tidbit of advice to help them on their healing journey today?
Yeah, I would say that if your life, feels like a 3-ring circus, go into one of those rings and put some of it on autopilot through daily habits, so that you just know that you're physical exercise, your mental exercise, your meditation, your eating habits, the timing of your meals, just whatever you can put on quote unquote autopilot through the daily routine, then you can basically have more effort to focus on the parts of the circus that do still feel like a circus. So just go in there and take care of whatever elements you can, like laying out your clothes that you're going to wear for the next day.
Right.
That's kind of what I'm alluding to. Because then you can actually have more time and effort to focus on the things that are maybe a little bit more complicated, or require more focused attention.
I agree 100%. Those little things can just alleviate so much space in your mind to focus on other things. Absolutely.
Yes.
So where can my listeners go to find out about your practice? And we also talked about your boot camps.
Yeah. So, the website is drgrasser.com, drgrasser.com. Right now, in terms of engaging in a program with me, I have teamed up with health bootcamps at healthbootcamps.com, and we have a gut boot camp that can be self-paced and start at any time. It's a 14-day elimination diet and lifestyle modification. It's totally affordable. Healthbootcamps.com/gut. You can check that out, and you'll get daily content and Facebook group and recipes, and pretty much you'll just get spoon-fed everything you need to go through the program. We've had some pretty neat outcomes with this already.
That sounds
for people
fantastic.
With weight loss and energy and all kinds of different things. And then I can do Ayurveda consultation remotely around the world. And again, if you just go to the website, you can send an inquiry through there.
Wonderful. That's fantastic. And I'll put all those links in the show notes, so you can just head on over to the show notes and be linked right up with Dr. Grasser. Dr. Grasser, thanks a million for coming on the show today. Sure. I really enjoyed our conversation, and I really appreciate the work you're doing in the world. It just makes me feel so positive for the future of medicine when I see you combining all these different healing systems. It's just fantastic. So thank you so much.
Yeah, and thank you, Colette, for your podcast and just bringing our wonderful Ayurveda community closer together.
There you go. We'll all do our bit, right?
That's right.
Thank you, Dr. Grasser. Take good care of yourself.
Okay.
Thank you.
Take care.
Bye-bye. I hope you enjoyed that conversation with Dr. Grasser. It was certainly interesting to see how he combines his practice of functional medicine and Ayurveda and his new approach to the membership style of healthcare, which I think is really positive in the future of how we teach people and empower people to take charge of their own health. So lots of positive signs there for the future of healthcare. And I will put all the links to Dr. Grasser's website and the health bootcamps in the show notes, so just check them out. And we also discussed in this episode about the importance of daily habits, which I talk about all the time, the Dinacharya in Ayurveda. And Dr. Grasser mentioned there at the end of the conversation about how it's important to put these daily habits on autopilot. So this is one of my signature courses, is the Daily Habits for Holistic Health course, where I guide and support you in this online self-paced course. It's 4 weeks long, to implement these daily habits. And at the end of the 4-week course, they're part of your daily routine. They're simple, effective habits to help you to prioritize your health and your self-care habits in your day. And when they're on autopilot, you don't have to waste energy thinking about them or thinking when you're going to do them. They're there set every day, just like you brush your teeth every day. And with that in place, it allows you more freedom and space in your mind to take care of your other priorities in your life. So I'll put a link to that Daily Habits for Holistic Health course in the show notes. It's available at any time. Like I said, it's an online self-paced 4-week course. Thank you for tuning in. It's always great to hear your feedback on the show. I've put polls up on the Elements of Ayurveda podcast group in Facebook, so please go over there, check out those polls. I also just put a post about any feedback you have your say, ask some questions. It's always great to hear from you. In the meantime, take good care of yourself and be well.